everyone. It's the final night, unfortunately. It's all coming to a close after an awesome week, but it's not over yet. We've got 2 excellent presentations coming up and then our closing party. So we over-ordered. So please don't be shy if you do need to fill up the glass as we go. And if we anyone thinking of staying on at Rusutsu a little bit, we've got a few at the end that we need to get rid of. So come see. From me, there's not really any announcements to tell you guys what's coming up or anything like that because it is at the end. So I think without any further ado, let's give a huge final night round of applause for Bodie, who's going to be talking to us first.
Hey everyone, how are the slopes today? Perfect. So, as Quentin mentioned, I'm Bodie. Firstly, just a huge thank you to Quentin and Dylan. I would never have come to Japan without having this conference, so thank you guys. So, how did I get here? I want to explain a bit about kind of me and my background. That's me second day on a snowboard. I'm a skier, and I'm never snowboarding again. I've axed myself so many times the past few days. But for me, I started as a paramedic over London Ambulance, Central Ambulance Service, so a pretty typical start to the career. I then kind of found that I wasn't seeing family, pretty much like you guys, working nights, weekends, all of that kind of thing. So I started working in the event sector, and I really loved festival medicine, motorsport, working with elite athletes, that kind of thing. I figured running your own business might be a better way to see family and friends and have more social time. I was absolutely wrong. It turned out I was working even more hours running a business. So after working in the film industry, I moved to Australia, did half a nursing degree, but halfway through was offered a job as a paramedic lecturer, and I could have been a poor student or a paid lecturer, so of course I chose lecturing. My research interest was in mindfulness, so this is where this becomes relevant. So I started researching mindfulness, and it became really, really obvious that mindfulness-based interventions are really good for us as healthcare professions. So I took redundancy during COVID because they offered it, and I thought that was a great idea because I got fed up of working in my 1-bedroom apartment in Sydney, only 7 steps. So that journey each day was a great journey. I moved to Queensland, finally trained to be a meditation and yoga teacher, and now I run a non-profit teaching meditation to doctors and nurses. So that's me. So mindfulness, what is it? Can I just have a show of hands, anyone who has done any kind of mindfulness before, informally, formally? Wow, amazing. I must admit, I didn't ever think I would stand at any kind of medical conference talking about mindfulness. We think only a few years ago, a lot of people. So the fact it's become so receptive kind of amazes me. But it's going to be individual to all of us. It's based on our life experience, good, bad, traumatic or otherwise. Okay, so everyone's experience of mindfulness will be different. It's a term, it's a Western term for a practice born out of many Eastern traditions. So the most common, the one you're probably most familiar with, is going to be, and I couldn't really talk about this without mentioning that. Other religions, or should I say religions, Buddhism is kind of a way of life, but other religions such as Catholicism, Christianity, Islam, all have prayer, which can be deemed as a type of mindfulness as well. Being on the slopes, maybe you've got headphones in, is probably, for some of us, a type of mindfulness. The Buddha was the first to attain enlightenment, but Buddha wasn't called Buddha until about the 1800s when Western scholars coined the term. Until then, he was just the first dude who attained enlightenment. And enlightenment essentially is the escape of suffering. So the human condition is kind of deemed as suffering. To be human is to suffer. So a lot of people meditate, particularly within the Buddhist tradition, to try and reach the stage of enlightenment. In the West, of course, we teach in a secular way. We kind of remove the sort of ethos of any kind of religion or sort of philosophy from it. It makes it more palatable and easier to understand, because trying to understand the Dharma, deciphering the Dharma, is actually pretty complex. It's written in Sanskrit and Pali, translations aren't easily available or are difficult to get hold of. So, John Kabat-Zinn was the first, one of the first back in the 1980s to create the mindfulness-based stress reduction clinic. He's based in Massachusetts in the US, and that was the first course that brought mindfulness to the masses, mostly to patients that were pretty much dissatisfied with their care in general. Particularly in the US, obviously, given funding arrangements and the way healthcare and insurance works, there were lots of patients that struggled with pain, stress and anxiety. And so MBSR was developed for these patients. John Kabat-Zinn's definition of mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. So let's unpack that a little bit. Attention can be... Oh. Yeah? Sorry? No, it's not meant to be moving. Did it move on its own? No, it's perfect. I don't use very many slides at all. I think there's about 8 slides for this whole 40 minutes. So attention, it can be quite directed or quite open. Okay, so let's try and move that into your practice. Who here runs cardiac arrests, maybe? Who's done an ALS course before? Beautiful, that's quite a lot of you. If you're running the arrest, you probably want quite an open awareness, okay? You want good situational awareness, you want to be taking in and processing as much as you can. If you are on a task, you probably want directed attention. And we can translate this back into our life as well, and I'll get there in a moment. But on purpose, are we really paying attention to what we want to be paying attention to, or are we distracted? Who here has kids? Parents, I believe you're really good at understanding what your kids are doing while also focusing on what you're doing. Okay, so we can have a separation of attention on different things. You might be distracted by social media, might be distracted by lots of what's going on. He talks about the present moment, because so often we're distracted by things that have happened in the past or worrying about the future. So we often ruminate on the past, maybe feel shame, anger, focus on the future, feel anxiety, and things like that. And one of the most difficult is non-judgmental. I'm going to pose a question to you that you can sit with for a few seconds. Are you as compassionate and kind to yourself as you are to others? So are you as kind and compassionate to yourself as you are to others? And I know when I teach meditation, a lot of people say the answer is no. As you can hear, I'm getting very dry. So, that's all in relationship to awareness. So, we all have awareness. You don't have to be Buddhist to have awareness, but you wouldn't expect to go to the gym and walk out after a couple of sessions with abs or knowing how to use every piece of equipment. Just as you wouldn't expect to do just a couple of meditations and expect to know how to meditate. I'm going to let you know now that meditation isn't as easy as everyone makes out. It sounds super easy when apps are advertising to you and they claim that you can do just 10 minutes a day. You can do just 10 minutes a day, but you've really got to stick with it. Has anyone ever tried meditation and dropped it or hated it? Anyone hate meditation? Oh, no hands went up, that's good. Half the people I work with absolutely hate meditation. That's who gets referred to me. So John Kabat-Zinn, again, he half tell anyone that you meditate if you are a meditator for at least the first few years, okay? You want to really focus on your practice rather than telling people that you do it. What I found is after years of meditation, it's just as hard and as difficult and as challenging now as it was back then. And that's kind of the idea of it. It's not meant to become easy. It's a challenge for yourself. It does get easier because you kind of know what to expect and you kind of know what can happen. But I still go through meditations, 45 minutes sometimes, where I finish and I think that was crap. I didn't achieve anything. My mind was busy. I've been on 7-day silent retreats and burst into tears during meditations. That is all absolutely normal. The last point I'd make here is that, you know, we go to school, we go to college, we go to uni, we study PE, physical education, we study math, science, language. You do your undergrad in nursing, medicine, paramedicine, whatever it is. But no one ever taught me how to use my mind. No one ever taught me how to really make the most of my mind. So, with awareness being the core of meditation, awareness sits within consciousness. And I wanted to explain all of this because often we download these apps and we give meditation a go, but no one's ever really explained to us the foundations that sits underneath it. So awareness being within consciousness, we are aware of our senses, sight, sound, you know, taste, smell. But no one ever told me that the mind was a sense. Okay, so all of those thoughts, feelings, and emotions. And that's recognized within neuroscience and particularly within Buddhism. So thinking of the mind as a sixth sense helps us when we start to meditate. You may have also heard the terms subject and object, that we might be the subject and the things that we feel, see, hear, do are the objects of our meditation. You may have been told to think about things when you meditate, to have an object of meditation. The work of meditation, though, is not necessarily about that, it's about afterwards. It's about how you relate to those thoughts, feelings, and emotions. And as a meditation teacher, the work that I do, particularly with students and when they're doing this for CPD, is to actually relate to those thoughts, feelings, and emotions. Okay, so we are going to do a little couple of experiments, I guess we'd call them. What I'd like you all to do is just think of something that makes you happy right now, whether that's family, friend, kid, being on the slopes. Just take a moment, keep your eyes open, close your eyes. Just take 15 to 30 seconds to think about something that makes you happy. I'll time it. I want you to feel that if you can. You're thinking about something in your consciousness, but can you feel what comes with that? Do you have any bodily sensations? Hands up if you're happy to share. Hands up if you felt anything with that. I knew no one was going to put their hands up. So often, when we think about something like that, did anyone get a warm feeling in their chest? Yeah? Did anyone get a light feeling? Did anyone crack a smile on their face? This is the purpose of meditation, is to really deep dive and not just sit there and be distracted by thought, but is to really learn how we relate to those thoughts, feelings, and emotions. So with practice, with repetition, you get better able to be aware of those senses. The reason I'm talking about this here today at an emergency medicine conference is so that you can better handle stress, burnout, and anxiety within your own life. So why do we need to be mindful? Well, rates of burnout are high in health professions. I'm sure you already knew that. Hands up if you're feeling a little bit burnt out or at all burnt out. Yeah, that's less than I expected actually. Maybe the snowboard holidays helping you all out. Sadly though, due to COVID, rates of burnout, stress, anxiety and depression have gone up, as you can imagine. Sadly, suicide rates are higher than the general population, about 1.5 to 1.7 times for men, about 2.4 times for women. And I think that's abhorrent. I really think we need to change that. Okay, mindfulness is just one way, but not the only way. Rates of stress, anxiety, depression, as mentioned, are higher in health professionals. Rates of divorce, relationship issues are higher in health professionals. Use of alcohol and recreational drugs are higher in health professionals. Lack of resources, increased